The United Nations Children's Fund, promoting healthcare accessibility. The United Nations Children's Fund, UNICEF, is a specific agency of the United Nations that is responsible for providing developmental and humanitarian aid to children around the world. Presented in more than 190 countries, it may be regarded as one of the most recognizable and widespread international social welfare organizations. From the year of its foundation till the present day, UNICEF has defended children's rights, saved their lives, and helped them fulfill their potential, from early childhood through adolescence. The organization's activities include the promotion of healthcare delivery for children in developing countries, disease prevention and immunization, the improvement of sanitation, education, and the enhancement of childhood and maternal nutrition. In addition, similar to the majority of world organizations related to healthcare delivery and human welfare, UNICEF provides emergency relief in case of disasters. UNICEF cooperated with partners all over the world to promote healthcare policies and provide access to multiple services that protect children's welfare and lives. According to the fund, every child has the right to grow up in a safe and inclusive environment. That is why it provides considerable support to displaced and migrant children. As a matter of fact, refugees, migrant workers, and their families frequently live in highly disadvantaged urban and rural areas with highly limited access to healthcare and other essential services. Displaced and migrant children traditionally face multiple challenges that may include discrimination, violence, exploitation, poor education, and improper medical care. UNICEF works all over the world to provide humanitarian supplies, equipment, and medications for healthcare providers who work in almost inaccessible areas and refugee camps. UNICEF additionally supports the initiatives, policies, laws, and regulations of local and national governments that address the special needs of children with disabilities. These children are frequently among the population's poor members and have substantially limited access to medical services as well. UNICEF contributed to the ratification of the Convention on the Rights of the Child, which is defined as the first international treaty to explicitly recognize the rights of children with disabilities. The fund promotes the rights of children with disabilities for accessible healthcare and education. In addition, UNICEF protects the rights of every child to life and health through the implementation of various strategies to reduce maternal and neonatal mortality. The organization supports the agenda for sustainable development that addresses the significance of accredited programs for appropriate education of healthcare providers, in-service training, and legislation changes for the effective reduction of mortality rates by 2030. In addition, UNICEF is the custodian and co-custodian for 19 Global Sustainable Development Goals indicators and promotes the protection of children all over the world through methodological work and the maintenance of international standards. Custodian health-related indicators include neonatal and under 5 mortality, and co-custodian health-related indicators refer to professional attendance at birth, children's immunization, sanitation, and anemia in women. UNICEF provides free access to the results of its activities. The efforts of UNICEF, the Bill and Melinda Gates Foundation, and other partners led to the vaccination of almost half the world's children. Due to the organization's hard work, implemented strategies, and provided services, between 2014 and 2018, almost 200 million children all over the world were vaccinated against measles. In 2016, UNICEF initiated a 50% price reduction for the pentavalent vaccine that protects against major child-killing diseases. By 2020, this initiative is expected to save 5.7 million children's lives. In 2018, the first drone-delivered vaccine helped to save children in Vanuatu. It marked the creation of essential practices that will help to provide medical aid for children in inaccessible areas. It goes without saying that UNICEF's implementation of practices that promote equal access to healthcare regularly faces economic, social, physical, and cultural barriers. In fact, early investments in the development, education, and health of children may guarantee their successful future. For developed countries that support the welfare of future generations, accessible primary, acute, and extensive healthcare is a priority. However, political conflicts, poor economic conditions, or cultural peculiarities of a substantial number of developing countries, Uganda, Nigeria, Lebanon, or Syria limit the opportunity for UNICEF to support and protect children. Nevertheless, UNICEF expends all efforts to promote an equal opportunity for all children to receive medical aid and improve the quality of their lives in all parts of the world. UNICEF supports training for physicians, nurse practitioners, and volunteers as well. For instance, in cooperation with the Ministry of Health Sexual Reproductive Health Unit, the organization is conducting particular training for nurses to equip them with the necessary skills for high-quality healthcare delivery for children and adolescents. In general, with the help of UNICEF, nurse practitioners provide medical aid all over the world.